Primary care physicians all across America are seeing patients with prediabetes.
This is you, where I tell you you have prediabetes. If you don't do anything, 2 years from now, less than 5 years, you're going to develop diabetes. You will be on all medication. You might have to take insulin. And the cost to society.
14% of their adult population has type 2 diabetes. And 5 years from now, they can expect the number of patients that they care for with type 2 diabetes to increase by probably at least 50%.
Type 2 diabetes places a heavy toll on patients and families, and it costs our nation more than $300 billion a year. Bending the diabetes curve requires successfully targeting those with prediabetes.
Prediabetes is an actionable step. The most important thing that a physician can do is refer their patients to the National Diabetes Prevention Program.
The National Diabetes Prevention Program, or NDPP, is an evidence-based lifestyle change program.
We took a look at all of the possible prevention options out there and very quickly realized that the National Diabetes Prevention Program offers the best intervention.
When reaching 100 high-risk adults, the NDPP prevents 15 new cases of type 2 diabetes, 162 missed workdays, $91,000 in other healthcare costs, and it adds an equivalent of 20 perfect years of health.
Diabetes prevention is really one of the most important things that as a country we can take on, and physicians have a really, really important role to play. Not just managing a chronic disease, that you can actually improve the quality of life because you refer them to the National Diabetes Prevention Program. That's a huge contribution that physicians can have.
Clearly the issue of how do you manage chronic illness and even better how to prevent it is something I've always tried to address, but it's hard to do in the time frame, and frankly I'm not always the most culturally appropriate person to really talk to people about what they do.
Well, the peers in the class, they were very welcoming and everybody gave their opinion, and then we learned from each other.
We trying to help the community, our community, because sometimes doctors are really speedy and they just say, well, you take this and you take that.
Okay, Miss Palmer, this is for the pressure, this is for the sugar, and that is for that, and that for that. But I get experience here.
That we take time to teach them something they don't have time to teach them. They feel more comfortable to come here and talk with us about, because we're in the same level, we're in the same community. So we all feeling the same thing about how this disease is taking over the borough.
They teach us a lot of things about our diabetic, and that's what I did need.
I do now eat in a small plate. I try to eat more veg, and that's what I had learned from here.
I lost a lot of weight. My goal weight was 10 pounds, and I lost more, 15. That's one pant size.
And when you hear the participants say, oh my God, I didn't know this.
They be flabbergasted, like, oh my God, I didn't know. So them knowing this, they feel good about themselves.
It was just so breathtaking just to go do something like that. It's worth it.
When people get to talk with others who they feel more comfortable with, they talk a lot more and a lot more can be accomplished. Just when people are comfortable, they change more.
Here at QTAC New York, we wanted to find a way for physicians to easily be able to refer their patients to lifestyle change programs like NDPP. That's why we created the Compass Physician Portal. Compass by QTAC New York is a unique web-based workshop and data management tool designed to assist organizations in the delivery of nationally recognized evidence-based health promotion and disease prevention programs. The Compass Physician Portal is designed for ease of use for physicians. It's a HIPAA-compliant electronic resource. There's no paper referrals to fill out or keep track of. You can immediately place people in classes, or you can place them on an interest list, and QTAC New York staff and local program coordinators will help find a class that suits your patient. You can get feedback on attendance and achievement of milestones by e-fax to your EHR or EMR. and it's supported and operated by QTAC New York, with 12 years of experience supporting evidence-based programs, and by a network of community-based and health-related agencies with trained and certified leaders, coaches, and trainers in evidence-based health promotion, prevention, and self-management programs. These programs target the chronic conditions affecting the quality of life of your patients and challenging the resources of your practice or clinic.
The advantage of the portal is we can track it, we can retrieve it, we can email it. It's a good tool for data collection.
I have all that data at my fingertips. You can see whether people are succeeding or not succeeding and where you can help in a very focused way as a physician. You're not throwing your patient away to someone else or losing contact, but rather increasing contact with other aspects of their lives.
The provider needs to be engaged. We cannot leave it alone to others to convince those patients. For me, it's a no-brainer.
We find time for the things that are important. What's more important than your health? At the end of the day, our health is the only thing that we really have.
Adding a community group that can teach my patients how to either prevent diabetes or to manage their diabetes has been a spectacular assist to me in my practice. It just makes my life easier and makes my practice better.
We are so welcoming to these people that it's like we doing it to ourselves because we all in the same community. Treat them with love and at the same time with knowledge, and they enjoy so much. They are willing to come back.
I'm very grateful. I'm very grateful for the class because it was good for me. They start the class again. I sure I will be here.
For more information about Compass and QTAC New York, please visit qtacny.org.